Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
We've all heard them growing up, and many of us probably tell them to our own kids. They're the myths and wives' tales that we've grown to love. But today, to debunk some of the most common ones, we have Dr. Tyrrell of UMass Memorial. So Dr. Tyrrell, let's start with one of the most common ones, that reading in the dark is going to hurt your eyes. True or false?
So such an interesting myth that's been around for so long. As it turns out, there's actually no evidence showing that reading in dim light or dark light actually has any negative long-term impact on your vision. There were some studies done some years back by a group of ophthalmologists showing that people who read in dim light didn't blink as often. Their eyes became more dry. As a result, their vision wasn't as strong at that time. But then when they came up into normal light, their eyesight returned to normal again, and they didn't have any further problems. So really the myth of vision being affected in a long term by reading in dim light actually has no real basis in science.
Cereal and solid foods, will those really help to put your infant who may not be sleeping so soundly to sleep?
So this one is absolutely ubiquitous. Grandparents, parents, everybody I hear, they say, oh, I really should start some cereal so maybe my child will sleep through the night. And that is held today, even today, by many people, even with evidence saying that there's actually no basis for that. The most quoted of the studies dealing with this actually looks at over 100 babies, and where they had the parents keep very close track of their child's sleep. And they asked half of those patients, half of the parents of those children, to actually put rice cereal in their babies' bottles. And for the next 20 weeks, they very closely tracked how much their children slept. And they found that those who received the rice cereal slept the same amount as those who didn't receive any rice cereal, really making this one of the most common believed myths out there. Unfortunately, that is just, it's a myth. It doesn't stop people from doing it because parents are so desperate to have their children sleep through the night.
What about the kids get a little bit older and we start giving them some treats, some candy? What about the myth of some people that believe that sugar actually is not going to make their child hyper?
So this one, I think no matter what we say during this interview, I can't imagine that what we say is going to change this view, because I've talked to so many people about this. And this is an incredibly well-researched topic, and with numerous studies looking at the content of sugar in food and sugar in drinks on children and their level of hyperactivity. And there has been no correlation between hyperactivity and the amount of sugar a child takes in. Further, and this may illustrate things, there was a really interesting study where they took a group of children and they separate those children into two groups, and they had the parents of those children very closely track their activity. They gave half of those children drink A and half of those children drink B. And the parents were told that the children who received drink B, that was a high sugar containing drink. In drink A, the parents of those children were told that it was a low sugar containing drink. The parents who thought their children were taking a high sugar drink universally recorded their children as being much more hyper. Now, as it turns out, the drink that all of the children were given across the board was all sugar-free. It just gets into that we have this mindset that sugar will make our children hyper, and we'll see it even if it doesn't exist.
When it comes to candy, everything, we always have the gum chewing warning that I even heard when I was a kid, that if I swallowed my gum, the gum would stay in my stomach for 7 years. So do I have gum in my stomach that maybe I accidentally swallowed 7 years ago?
I'll tell you, I catch myself saying this one to my children as well. But actually, as it turns out, there's no basis for this one at all. Now, it is true that gum actually isn't digested well. That gum is made up of products that really won't be digested in the stomach or the intestines for quite a while. But scum goes into the stomach, and it's acted on by the acid in the stomach and then by the enzymes in the small intestine. And they really don't do much to break it down. But the stomach and the small intestine churn at that gum and push it along. So although it's not digested, It moves through the intestines, and after 1 to 2 days, it's passed through and out into the toilet, and it really doesn't cause a problem. The only issue with gum chewing and swallowing gum is that if you swallow a great deal of gum, you could end up with an intestinal block, but swallowing an occasional piece of gum actually has no health risk at all.
So what about when we are eating dinner or we have a snack, drop it on the floor, or maybe your child drops something on the floor, and you hear the common 5-second rule, and everyone jumps down, picks it up, and gives it a quick, blows it off, eats it. 5-second rule, true, false? I mean, is there anything behind this?
I have to say, this is my favorite of all of these medical myths because I use it all the time. Not when I'm in the hospital, but at home, we absolutely follow this 5-second rule. But I love this one because actually a group of researchers took this myth on, and they studied it in real detail. They took salmonella, a common pathogen that causes vomiting and diarrhea, and they put it on surfaces. They put it on tile floors, wood floors, and carpeting. And they found that salmonella, after 4 weeks, would stay on those surfaces to an extent that it could still get you sick. Step 2 of this experiment, they took bologna, and they threw it on each of these surfaces for 5 seconds. They found in 5 seconds, 99%, almost all of the salmonella had jumped from the tile floor onto the bologna. The numbers were much less on the wood floor and even less on the carpeting. Actually, only 0.5% of the salmonella transferred from the carpeting onto the bologna. The tile floor, which is the common flooring in kitchens, actually bacteria transfers very quickly on those surfaces.
So maybe if we drop our bologna on the rug, we should be able to eat it still, but just not in the kitchen?
That would follow.
In the summertime, we all eat picnics, outings, and then obviously want to go swimming. But we've all heard that you should wait an hour before you go in the water because it can be dangerous. Is that something that has any truth behind it?
There's no data actually showing that there's a safe time or a dangerous time to swim after you've eaten, as much as we all have heard that and have said that to our own children. Now, as you can imagine, this is a hard topic to research, but there are a group of people who've actually looked at this topic, and they've looked through the literature on all reports of drowning and near drowning. And in none of those reports is there any connection to the person who drowned or those who had a near drowning experience in eating close by. Now, further, the Academy of Pediatrics actually doesn't have any recommendation on when a child, anyone should swim after they've eaten. The most important thing with swimming is really making sure that swimming is well supervised and you're swimming in safe areas.
So when babies are teething, is it true that the teething in itself can actually induce fevers in the child?
Now, this is also a very commonly held belief, and this actually doesn't. There have been some studies on this, and it actually doesn't really hold up either. Teething, although there's certainly side effects of teething, there's a lot of drooling. A child can be uncomfortable, sleep less, but there's actually no connection to actually developing a fever when you're teething. And this was actually looked at with very close parent records. When children were young, parents would keep track on a daily basis of their child's temperature and when they actually broke teeth, and they found no correlation to actual development of a fever, either low grade or high grade, and breaking teeth.